Stroke: causes, symptoms, diagnosis, and treatment. Stroke is the fifth leading cause of death in the US, with one person dying every 4 minutes as a result. Approximately 800,000 people have a stroke each year. Only heart disease, cancer, chronic lower respiratory diseases, and accidents are more deadly. Stroke occurs when the supply of blood to the brain is either interrupted or reduced. When this happens, the brain does not get enough oxygen or nutrients, which cause brain cells to die. There are three main kinds of stroke: ischemic, hemorrhagic, and TIA. This article will focus on ischemic and hemorrhagic strokes, as there is a separate Knowledge Centre article for TIAs, which goes into specific detail about them. Stroke is also more likely to affect people if they are overweight, aged 55 or older, have a personal or family history of stroke, do not exercise much, drink heavily, smoke, or use illicit drugs. Ischemic stroke is the most common form of stroke, accounting for around 85% of strokes. This type of stroke is caused by blockages or narrowing of the arteries that provide blood to the brain, resulting in ischemia, severely reduced blood flow. These blockages are often caused by blood clots, which can form either in the arteries connecting to the brain or in the blood vessels before being swept through the bloodstream and into narrower arteries within the brain. Clots can be caused by fatty deposits within the artery called plaque. Hemorrhagic strokes are caused by arteries in the brain either leaking blood or bursting open. The leaked blood puts pressure on brain cells and damages them. Blood vessels can burst or spill blood in the middle of the brain or near the surface of the brain, sending blood into the space between the brain and the skull. The ruptures can be caused by conditions such as hypertension, trauma, blood thinning medications, and aneurysms. Intracerebral hemorrhage is the most common type of hemorrhagic stroke and occurs when brain tissue is flooded with blood after an artery in the brain bursts. Subarachnoid hemorrhage is the second type of hemorrhagic stroke and is less common. In this type of stroke, bleeding occurs in the subarachnoid space, the area between the brain and the thin tissues that cover it. TIAs are different from the aforementioned kind of strokes because the flow of blood to the brain is only briefly interrupted. TIAs are similar to ischemic strokes in that they are often caused by blood clots or other debris. TIAs should be regarded as medical emergencies, just like any other kinds of stroke, even if the blockage of the artery is temporary. They serve as warning signs for future strokes and indicate that there is a partially blocked artery or clot source in the heart. According to the Centers for Disease Control and Prevention, CDC, over a third of people who experience a TIA go on to have a major stroke within a year if they do not receive any treatment. Between 10 to 15% will have a major stroke within 3 months of a TIA.